Joining us via Skype from Monrovia, Liberia, is Dr. Lance Plyler. He's with Samaritans Purse. Dr. Plyler, tell us, how bad is the Ebola outbreak?
In regard to Ebola outbreaks, it's really unprecedented. Right now, it's not just a problem within a given country, it's a real sub-regional problem. And the western parts of Africa, in particular Sierra Leone, Guinea, and Liberia, have been profoundly impacted. So it's really, again, unprecedented in terms of geographical distribution and in terms of patients infected. Right now, it's still unfortunately on the rise, but total cases in the region is approaching 900. So it's a monumental problem.
So remind us now of the symptoms. How deadly is this disease?
Well, it's definitely one of the deadliest viruses known to man. The symptoms really, what's really unfortunate is that it can really mask a lot of diseases that are endemic to this region, such as malaria or typhoid. And initially, the person presents with fever and then a malaise, so they just feel very poorly. Associated with that, their muscles and their joints begin to ache very intensely. It's followed by nausea, vomiting, diarrhea. And then in the very advanced cases, there can be bleeding. I know a lot of the media presents that these patients are all bleeding profoundly. That's not the case, but it can be true in the very advanced cases where they will have some significant bleeding.
So how is the disease spreading?
Well, initially what happens is there's some reservoir. We believe that reservoir is most likely a fruit bat. And the people in this region, they eat what we call bush meat, which can involve eating bat. And that's what occurs with the primary transmission, is that a person will eat some meat, perhaps bush meat, perhaps a bat, and they will be the primary or the index case. And then that person becomes infected. And then unfortunately, through the transmission of body fluids, the people that they come in contact with, they transmit that to others. It's very, very infectious through body fluids. So that can be, through vomiting. It can be through the exposure to the diarrhea. But even, unfortunately, just through the transmission of body sweat. It's very cultural here with the burial ceremony that the loved ones prepare the body, and there's a lot of washing of the body and preparation for burial. And that is a very, very common mode of transmission. So we're really fighting against culture and their practices.
So is there any concern that this may spread to America?
I'm not an alarmist, and I think right now that's a very unlikely scenario. It's not impossible, but it's a very unlikely scenario. But it's certainly, again, it's a sub-regional problem that I think globally we should definitely be focusing on this problem and really working collaboratively to address the problem so that it doesn't become greater than a sub-regional problem.
What is Samaritans Purse doing to help?
Well, Samaritans Purse has been involved in Liberia for the better part of a decade now, and really historically, Doctors Without Borders has been the go-to humanitarian organization for treatment of Ebola or viral hemorrhagic fevers, and they do a phenomenal job. As I said, this outbreak in particular is unprecedented. Doctors Without Borders they're very involved in Guinea and Sierra Leone, and they've played a pivotal role in Liberia too. A few weeks ago, when we heard that, and you heard the statements as well, that this was becoming out of control, and in a sense, they were making an appeal to the greater humanitarian community. Given our roots here, we felt a real moral obligation to step alongside with Doctors Without Borders and provide direct patient care. In addition to patient care, we're really working very hard on communications through public campaigning to reach out to the public. We're taking multiple modes of communication to get the message out. What are the symptoms and how can you prevent it? That's really what's going to help eradicate this epidemic is proper education and communication with the public. And so Samaritan's Purse is really doing both case management and communication with the public at large.
What can our viewers do?
Samaritan's Purse is working in partnership with the Liberian Ministry of Health. We're working with Doctors Without Borders, and we would really just appeal to the public at large. They can go to the websites of Samaritan's Purse and these other organizations and make financial contributions. Even on our website, we have, fortunately, a very large capacity or cadre of doctors and nurses that can respond. But as this grows, we want to be able to provide that hands-on, if you will. And so we need doctors and nurses to assist. You can go directly on the Samaritan's Purse website, and if you're qualified, again, we have a lot of medical personnel that can do that. But I would say, that we need, globally, we need to draw more attention to this, and there just needs to be more resources, including financial resources, poured into addressing the problem.
Dr. Lance Plyler of Samaritan's Purse, thank you for joining us.
Thank you. We appreciate it.